Good morning to all of the West Coasters and early afternoon to our East Coasters and everyone in between. So welcome to the Psychosocial Oncology Professional Symposium for 2024. Kelly and I will be kicking you off this morning with some opening remarks. So what we'll cover in this session is definitely a quick welcome and who we are, meaning the cancer support community, and a little bit about what we do. Kelly's also going to give you a nice overview of the conference and what's ahead, as well as how to collect those great CEs and filling out all of your evaluations. Before we get started, we of course want to shout out to our sponsors. We can't do educational symposiums like this without them. Leukemia Lymphoma Society has been a great partner, both in program and education to cancer support community, as well as ASI and Sanofi. So thank you again to our sponsors. There are a couple of CSC booths for you to visit during the conference. So when you have a few minutes between sessions and on breaks, we welcome you to go check out the booth on the CSC My Lifeline, learn all about that tool for patients and their caregivers and loved ones, as well as our cancer support helpline. So our mission at CSC is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. Our vision is that everyone impacted by cancer receives the support they want and need throughout their experience. We have three pillars, three legs of our stool at Cancer Support Community. So first and foremost is our direct services stool. It is our largest leg of our stool, and it includes our network, our over 196 locations throughout the US, Canada, and a few overseas, primarily staffed by licensed mental health providers and oncology social workers, many folks just like you that are on the webinar today. Also in our direct service arm is our helpline and My Lifeline, which we have booths on that you can visit, as well as our program and educational services. We also have a policy and advocacy arm at CSC. We do advocacy work both at the state and federal level and really advocate for anything that has impact on a cancer patient, their caregivers, and loved ones. And last but not least, we have our Research and Training Institute, where we conduct novel research really on psychosocial, behavioral, and survivorship research related to patients and caregivers. Our research is very different from a lot of other cancer organizations in that we are not researching a cure for cancer or treatments for cancer. We're focused entirely on psychosocial behavioral health and the impact of cancer on a patient and their caregivers. Next slide.
Sorry, it's being really slow to advance. There we go.
Okay. And the last thing I want to share with you today before I turn it over to Kelly is our reach. So I know this is a busy slide, but it's a snapshot of our network and all of our many network locations. So what you're seeing on this screen are our hubs. We cannot fit all of our spokes on one slide in all 196 locations, but this gives you a good idea of the major markets that we are located in and how we are serving people. And I will hand it off to Kelly.
Thanks, Sally. So before we start the symposium today, we just want to make sure that you're available, aware of some of the resources that we have for you through the cancer support community, as well as through our CSC and Gilda's Club locations worldwide. So we do have a helpline that is available for you as professionals to call as well. We get a lot of patient and caregiver calls on the helpline. You can check out our helpline booth during the exhibitor breaks later today to learn more. But it's something that you can call as a professional as well to get additional resource and referral information for your patients, the caregivers you might come across. We do provide support in up to 200 languages on the helpline. And then as you can see on the screen here, we also have some specialty navigators. We have a CAR-T navigator, Gabrielle, you'll actually be meeting her later today or tomorrow. She's one of our moderators. We have clinical trials, financial navigation, genetics, genomics, pediatrics, and can help with a lot of travel, housing assistance, and many, many other things. Our helpline team does follow a proactive navigation methodology, which we're excited to hear what Sally and her co-speaker Elizabeth Franklin will have to say later today about navigation. Digital resources, as you heard Sally say, there will also be a booth on our My Lifeline tool. My Lifeline is our digital platform where people can share in a private and secure space their cancer journey, whether they're the person with the diagnosis or the caregiver. It's password protected if they choose. It is privacy protected. The information is all theirs. They can do blog entries. They can have a support calendar and really form a digital connection online with others, either who know them or they can make new connection through our different discussion boards. We also have a virtual CSC where we provide a kitchen with some cooking demos and tutorials. There's a library that you can browse for free resources. The support room gives you an idea of how people will receive support if they attend support groups, either virtually or physically at one of our 196 locations. Mind Body Studio for those who want to get a little bit of movement in, some yoga, meditation, for instance, is in there. We also provide information on how to be an advocate through our Action Center. And you'll find different study information on that page as well. Want to also make sure that you're aware of Frankly Speaking About Cancer. This is our award-winning educational series. So what we do is provide a different modalities of education, sometimes checklists, sometimes webinars. There's discussion tools, a lot of quick guides where people can learn either about a specific cancer type, they can learn about coping with the diagnosis, and they can even learn about different treatment options through these resources. Cancer Transitions is our survivorship program. We've really evolved and modified this over time. It's now available through 4 sessions. It does fulfill requirements for Commission on Cancer accreditation, and there's also digital versions of it. So we currently have a patient version, a caregiver focused version, a young adult version, and we're currently piloting a CAR-T version of Cancer Transitions. So a continually evolving tool. And I neglected to mention there is a Spanish version of this as well. Because we want to meet people where they're at, we also started a peer clinical trial support program. Phase 1 of this is really focused on the Black and African American community. So what we do is we train people who participated in clinical trials to be an advocate and a support person for those who want to learn more about clinical trials. Our next phase will be focused on Spanish-speaking communities as well. We always have events coming up across the network and through headquarters as well. So a few that I want to highlight right away is we have a mental health and impact on head and neck cancers. That one is on October 15th. And when we share out the slides, all of these are clickable to take you directly to these different registrations. Or if you follow us on social media, you'll find all those links there. On October 29th, so at the end of the month, we have the times are changing, and so is Medicare. This one is going to speak a lot about M3P. And then finally, we have Myths About Grief coming up as part of our Helping the Helper Toolkit series. That one is taking place on November 7th. So as you can see on the screen, hopefully you can see it on the screen, these are all evening sessions. They are all webinars. So if you can't make it but want the information, go ahead and sign up. They will be recorded. We'll also post recordings on our YouTube channel after they've been broadcast. All right, diving into Psychosocial Oncology Professional Symposium 2024, or POPS. So today we are going to be joined by Dr. Frederick Reamer. He is our first session to kick off the day. He will be talking about digital ethics and risk management in psychosocial oncology. I heard him speak through an AOSW presentation. He does a wonderful job. After that, we'll hear from Dr. Brooke Worster and Gray Garber. They'll be talking about cannabis and cancer care. Then we've got Sally and our friend Elizabeth Franklin from Sanofi to join us to talk about navigation and reimbursements. And then another AOSW friend of mine, Linda Hutkin-Slade, is going to join us to talk about the impact of cancer-related cognitive impairment on patients and caregivers. So hopefully everybody's as excited about today's lineup as I am. Tomorrow, we'll start off our day with Sarah Field talking about the impact on us, vicarious trauma, burnout, and self-care. Always a great topic to include. Dr. Michelle Fingret is going to talk to us about body image for those going through a cancer diagnosis. Then we'll be joined by members of our health equity and policy teams, Audrey Davis and Deneen Ciccone. They'll be talking about none other than health equity and policy. And then we'll wrap up tomorrow with Dr. Lauren Gazelle. She'll be talking to us about adolescent and young adult cancer survivorship. So again, really excited for the lineup. What you're probably all really anxious to hear about is how do you get your CEs? So we will pop into the chat throughout the sessions because we know some of you are only attending today, some of you are attending the full 2 days. So we'll pop the chat in at the end of the sessions. You do need to attend virtually the entire session to get your credit, but you'll have until December 20th to claim your credit. I suggest if you're attending both days, wait until the end of the symposium to claim your credit because it's as simple as letting the system know how many sessions you attended. We'll also have an evaluation and ask for your feedback about the symposium as we've done in the past. I want to see if anybody has questions, and while I wait to see if any come in, also have a request. As you saw in your reminder email, we would love pictures of you attending the conference, or the symposium rather. One thing that we often don't get the privilege of is seeing your faces because we want to make sure that this is a relaxing environment for you. It will be in webinar format, so you'll see and hear your speakers, but you will all be using the chat and Q&A tools. So we won't get to see your faces. So if you have a chance, please send us pictures. If you're one of our network partners, you likely already have my cell phone number and can text those as well. So how will you access the recorded sessions post-conference? Great question. As soon as we have a chance to trim those down and edit those, we will be adding those to our website. There will be a follow-up email for all conference attendees with the direct link to that as well. And those will be available until February 10th. While I'm waiting to see if there's any final questions, I wanted to advance to mine and Sally's contact information. There is a question about giving your license number for the CE credit. That is all going to be part of the process of enabling your CEs at the end of the conference. All right. Well, we don't like to take up too much of your time for these welcome remarks. We just want to make sure that you have a chance to learn about the great network that we have. We'll give you a short, looks like maybe 15-minute break before we are joined by Dr. Reamer, our first speaker to talk about digital ethics, risk management in psychosocial oncology care.
Thanks, everyone. Have a great symposium.
Thanks, everybody.